Welcome to day 2 of this celebratory meeting for the Environmental Research Group's 30th anniversary. A couple of announcements to begin with for those who weren't with us yesterday. We had a fire alarm test at 9 o'clock this morning. We're not expecting another test, so if it does go off, then we've all got to exit at the back of the room and follow staff out to the left, out onto I think it's St. James's Precinct it's called. So there is Wi-Fi, free Wi-Fi should you need it. Just log on to that, but don't spend all the time looking at your phone or your computer, please. We've got some really interesting presentations coming up today. We're having 2 coffee breaks and lunch again. Most of you have already been in the room where that's happening. And in there are posters and there are demonstrations of the work that the teams in ERG are up to at the moment. So please spend some time looking at those. So, as an introduction to the day, I guess over the last 30 years, we've taken on a number of new challenges. You heard about all the work yesterday about the measurement and modelling of air quality. Well, in more recent years, we've expanded our focus out into water as well. And you're going to hear about some great research that we're doing there by the Emerging Chemicals team this morning. In the tragedy that's happening in our rivers and the emissions that are coming from the wastewater treatment plants. And you'll hear about some excellent analytical techniques that have been developed where we can now basically identify and measure to a certain extent, thousands of chemicals which are present in that effluent. It's a matter of increasing national importance, and you've probably read lots of pieces in the media about this, and it's, the public are getting very worried about it. So we're in a very good position to identify the issues, and as you would expect for ERG, to come up with some solutions for it and try and improve the situation. You're also going to hear from our microplastics team, which we started, I think it was back in 2015. This came about in an interesting way because we actually thought, or at least I actually thought, that we had sort of gone a long, long way to deal with vehicle emissions by dealing with the exhaust emissions from vehicles. So we're moving away from diesel and petrol. Eventually, we'll have electric vehicles only coming onto our roads. And then we started looking at the other emissions from the vehicles, from the tires, the road wear, the brakes, etc. And when we found out modern tires 55% plastic, and we started thinking about the amount of tire wear that you get, thousands of tons every year, we started really worrying about microplastics. But the techniques weren't there to be able to identify them, so that's really where the first 5 years big PhD project was evolved around that, to come up with the analytical approaches to identify microplastics which were in the breathable or inhalable range, less than 10 microns. And you'll be hearing about that work. And the challenges that there are then to determine whether they really are posing a health risk to us. So you're going to hear also from 2 other teams, really important teams who really do a lot of work which provide us the underpinning for developing policies, need to develop policies to improve our air quality and our water quality. One's the epidemiology team and one's our toxicology team. Now, as a toxicologist myself, I find epidemiology a bit of a dark science. But you will hear some excellent work that we've been doing in that area. Really, and the story will be told. Starting back from our year start 1993, when the 6 city study was published in America. and the incredible work that's been done since then. And really, epidemiology does underpin, all our strong policies in this area. So it's very, very important. You'll also then hear from our toxicology team, and you'll be taken through a journey of development, which will describe the sort of pioneering work which they have undertaken, working with colleagues in northern Sweden in the University of Umeå, undertaking human challenge studies, showing that when you breathe in a pollutant like diesel exhaust, the reactions that occur in the epithelium of your lung involves inflammation, involves oxidative stress. You'll hear lots of these strange terms, but don't worry about that. The bottom line is we now have a very good understanding of why these pollutants lead to cell damage and eventual disease. So that's going to be really interesting as well, hopefully for you. And then at the end of the day, we have our piece de la resistance, because we're going to have a panel discussion. The chair of the panel discussion will be Shirley Rodriguez, who is Deputy Mayor of the Environment and Energy here in London, and part of Mayor Khan's team working in this area. And on that panel, we're going to have Rosamund Kisadebra, who, as you all know, is a mother, an air pollution activist, and a WHO advocate for health and air quality. We've got Francesco Forestier, who chaired one of our sessions yesterday morning, who has served for 4 decades at the Lazio region in Rome and health services there. Dan Greenbaum, who's president of the Health Effects Institute in the USA, an incredibly important funder of work in this area. We also have Camilla Kingdom, who is president currently of the Royal College of Pediatrics and Child Health, and is a leading voice for children and young people in the UK. And last but certainly not least, we have Sarah Woolnough, who is CEO of Asthma and Lung UK, a charity that strongly supports work in the area of poor air quality and health.